Greetings, y'all. Just wanted to make an audio about a medical condition known as acid reflux, also known as GERDS. GERDS is an acronym for gastroesophageal reflux disease. So, what is acid reflux? Well, acid reflux is a condition whereby there is an excessive amount of acid in the stomach, and it is often coming back up through your esophagus and often causing symptoms like heartburn, and it can lead to other medical conditions. Okay, so how is acid reflux caused and what are some of the other symptoms? So according to Wikipedia, one of the main causes of acid reflux, no, it's not a cause, but it says that acid reflux is due to poor closure of the lower esophageal sphincter. Now, your lower esophageal sphincter is like a flap of flesh that is between your stomach and your esophagus, and it allows food and, I imagine, fluids to go down into your stomach and prevents it from coming back up your esophagus and into the back of your throat. So there's also a link between obesity and acid reflux. It seems that the additional weight puts more pressure on the stomach, forcing the food to come back up through the sphincter and up the esophagus, contributing to acid reflux. Likewise, constipation, the strain on your stomach when you are forcing yourself to go to the toilet, is also potentially causing food to come back up through your esophagus. It's also stated that gallstones can impede the flow of bile going into the stomach, which is needed to neutralise the stomach acid. Smoking is also associated with acid reflux. Similarly, carbonated beverages, pop, fizzy drinks, Coca-Cola, Pepsi Max, you name it, these fizzy drinks are associated with acid reflux, including alcohol and also coffee. Now, it seems that there are also dietary related factors contributing to acid reflux, and it also seems that these are not often cited in mainstream information. So quite importantly, diets that are high in fat and protein are also associated with acid reflux. In particular, animal-based foods, meats, cheeses, eggs, all have a higher concentration of acid, contributing to acid reflux. The other thing is that there is research showing that fatty foods relaxes the esophageal sphincter like a sedative. You can imagine the food just when you're moving around from A to B, bending, lifting, any kind of pressure on that abdomen is going to most likely result in pushing that food straight back up through the sphincter. So in turn, acid reflux may give rise to some of the following symptoms. We have mentioned heartburn already. However, you may also experience chronic and reoccurring sinusitis, if that's pronounced right. Bad breath is also associated with acid reflux. A feeling of a lump in the throat, difficulty swallowing, the swelling and irritation of the vocal cord, a sore throat, breathing difficulties, frequent throat clearing, hoarseness, and chronic coughing. In addition, people also experience their enamel on their teeth starting to corrode as a result of the acid coming up into the mouth and having a negative impact on the enamel. I also considered that for people who have fillings, amalgam-based fillings, which contains mercury, then I should imagine, just like with any other metal where there is contact with acid, there generally is a tendency of the metals to dissolve and be taken into the bloodstream and potentially contribute to the lodging of particles of mercury in various organs of the body. So how do we deal with acid reflux? Typically, people will purchase antacids which contain sodium bicarbonate and are known to be ineffective in approximately 90% of the people who use them. So the next thing that often ends up happening is that the patient will go to the doctors and ask for some help with their acid reflux, and the doctor will prescribe what are known as PPIs, proton pump inhibitors. And to attempt to name a few of these proton pump inhibitors, you have Nexium, Prevacid, Protonix, Acifex, Prilosec, Omeprazole, Dexlansoprazole, Pantoprazole, and Rabiprazole. So it'll usually be some derivative of these drugs that you are prescribed by your GP for your acid reflux. So 50% of the time, PPIs are overprescribed. So that's a fact. So in other words, people are receiving medications that they do not need or that are not going to be effective or suitable. Now, some of the problems with PPIs include increased secretion of acid. When people finish the course of PPIs, they often end up secreting more acid than they previously had. So they end up going back on to the medication. So not only can the problem be made worse by taking PPIs, they also have a toxic potential, and they can cause an imbalance in electrolytes, which in other words is disrupting the healthy balance of good bacteria in your stomach, which I imagine inhibits the uptake and absorption of various vitamins and minerals, such as vitamin B12 for example. And this messing with the gut microbiome is also increasing the risk of developing pathogenic bacterial infections such as C. diff, which apparently can be quite serious. So gastric acid is actually an important thing to have, as it helps to defend against bacterial infections. These acid reflux meds also increase the risk of pneumonia, increase the chances of bone fracture, heart disease, kidney failure, chronic kidney disease, all-cause mortality. And as I mentioned earlier on, there are some concerns about dementia. So while medications come with risks, neither is it a good idea to ignore acid reflux, because acid reflux can develop into worse conditions such as esophagitis, which seems like it is an inflammation of the esophagus. And moreover, it can also develop into what is known as Barrett's esophagus, which doesn't look good. The images just look a bit nasty. And from Barrett's esophagus, that can develop into cancer, adenocarcinoma. So what can be done to prevent and reverse acid reflux? Well, since we know the kind of things that exacerbates the condition, the sensible thing would be to reduce or ideally eliminate the practices that are contributing to or causing the condition, not to mention smoking, consuming alcohol, drinking coffee, and consuming a high-fat, high-protein diet, which is going to relax that esophageal sphincter, and it is going to increase the acidity in the stomach, and it's also going to increase weight gain. So now we know what we need to reduce or ideally eliminate. What is it that we could be increasing in order to help neutralize the buildup of acid in our stomachs? The answer is plant-based foods. Now, Dr. Michael Greger cites one study that suggests that the consumption of non-vegetarian foods serves as a predictor of developing conditions such as acid reflux. Also, egg yolks and animal products increase a particular hormone which I cannot pronounce, but it's something like something to do with cholesterol, and this is the kind of hormone, for example, that is relaxing the sphincter, which again allows for foods to pass back up into the esophagus. So yeah, definitely try and increase your intake of plant-based food. The majority of your greens, your cabbages, lettuces, kales, you name it, brassicas, cruciferous vegetables, cucumbers, whatever you can get your hands on, whatever you can start to implement into your daily routine, your daily diet, it's worth doing it. Yeah, there are some vegetables, fruits and vegetables that are acidic. However, the majority of fruits that are acidic are not so bad. Like, for example, anything from the citrus family will actually have an alkalizing effect on your stomach acid. So research what foods are alkaline and consume those foods, more of those foods. Also, probiotic is a good way to help regulate the acidity in your stomach. Having a good plethora of microflora in the stomach and intestine is pretty crucial in digesting and absorbing important nutrients and minerals. So probiotics, things like sauerkraut, things that are fermented, which I guess by nature has some acidity. However, the benefits, I think, outweigh the risks, because you're feeding your stomach with really important bacteria that will then in turn help to regulate the acidity in your stomach. I wouldn't recommend anything with dairy in it, however. Also, try consuming more water. The study basically shows that increasing water intake increases gastric pH faster than PPIs, with no consequences, no side effects. And yeah, so another study showed that adopting a plant-based Mediterranean diet with a high intake of fruit, nut, whole grains, vegetables, slightly alkaline water resulted in a significant reduction in symptoms of acid reflux, far superior to PPIs. And in that study, I believe it were only a 2-week long study, and within that space of time, I believe 20% of the people had no symptoms at all, whereas the others still had some symptoms. Whereas if the study had been for longer, it's highly likely that they would have fully recovered. Increasing the amount of fibre in your diet improves your bowel movements. It helps weight loss. It means less pressure on your stomach, pushing that acid back up the esophagus. And there is no association between a high fibre intake and the condition known as acid reflux. You know, when you transition into a plant-based diet, it's also important to know that you're not really losing or sacrificing your life for it. You know, you're not going to die. It's not going to kill you. I mean, it's going to make you stronger, and it's going to improve your health. It's well worth the transition. And what I'm saying is, you can still enjoy lots of good food, and occasionally, obviously, you can still treat yourself using plant-based substitutes or recipes that you never even knew existed. You can derive a heck of a lot of pleasure from plant-based foods, and it's a win-win for everybody. It's a win-win for every living thing.